The World Health Organization says all countries must strike a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights. Women's choices and rights to sexual and reproductive health rights must be respected, regardless of COVID-19 status. How has the country fared in maternal care as well as sexual and reproductive health services? That's our focus today on Soundhealth. I'm Olasunbo Modupe. Thank you for staying tuned. We begin today's show with COVID-19 updates.
The World Health Organization (WHO) has stopped hydroxychloroquine, lopinavir, and ritonavir trials for COVID-19 treatment. The recommendations were from UK Solidarity Trials International Steering Committee established by WHO to find an effective COVID-19 treatment for hospitalized patients. WHO says interim trial results show hydroxychloroquine and lopinavir and ritonavir produce little or no reduction in the mortality of hospitalized COVID-19 patients. In Lagos State, mask usage is now mandatory in public places. In line with the Presidential Task Force Directive on No Mask, No Service, Governor Babajide Sanwo-Olu is asking offices, businesses and commercial premises to refuse entry to any persons not wearing masks. He added that enforcement agencies will from this week charge defaulters to court as the period of grace is now over. Governor Sanwo-Olu also announced gradual reopening of schools from August 3rd, directing students in transitional classes who have mandatory public examinations ahead of them to resume for revision classes and their examination. He said only students in Senior Secondary School 3 and their counterparts in Technical Study 3 will be allowed to resume on August 3rd. The governor said the school's reopening must follow established public health guidelines and protocol in the state. The permission to reopen, he said, only applies to day schools while boarding activities are excluded. The dates for the revision classes and examination for pupils in Junior Secondary School 3 will be announced in due course. In addition, primary 6 pupils will be graded by their already recorded continuous assessment to pass over to secondary schools. Governor Sanwo-Olu also directed that hairdressing salons that had been accredited by the Lagos State Safety Commission could open strictly on appointment only and with a maximum occupancy of 50% of the total floor space at any given time, while sport facilities and recreational parks in residential estates would be permitted to operate with a maximum of 20 persons at any given time. However, places of worship, event centers and social clubs will remain closed until further notice. Also, the governor directed civil servants from grade level 1 to 12 to continue working from home and improve themselves through dedicated online learning management systems portals. Lagos State has reassured the general public that testing is still free at all the COVID-19 public testing laboratories for all residents. Hence, all residents are enjoined to take advantage of this service if they feel unwell or have had a close contact with an infected person. The government explained that sampling centers are established across the state and has continued to enhance the capacity of the public testing laboratories to test all those who require testing free of charge. It added that a consortium of 7 private laboratories were launched in the first phase as part of the testing strategy of the state to increase the accessibility of testing facilities to the organized private and corporate sector who wish to test for various reasons. The NCDC says the virology laboratory at the Federal Medical Center, Owo, Ondo State, has been included in the National COVID-19 Molecular Laboratory Network. This brings the total number of laboratories in the national network to 40. Work is also in progress on the completion of a laboratory in Gombe State. The Nigerian Institute of Medical Research has launched the country's first set of local ribonucleic acid extraction kits to help expand the nation's capacity to test for COVID-19. Director General of NIMR, Professor Babatunde Salako, explained that the local RNA kits would address the perennial problem of test kit shortage in the country and help ramp up daily testing capacity for COVID-19. More than 28,000 confirmed cases, over 11,000 discharges, and above 600 deaths have been recorded in Nigeria.
Maternal care and sexual and reproductive health rights services are also key parts of health care and must be offered regardless of the present situation. Due to COVID-19, unfortunately, many are experiencing limited services, especially sexual and reproductive health rights. Today, Dr. Alero Roberts, a public health physician and a maternal and child care specialist, will share our expertise on how to effectively manage sexual and reproductive health rights and maternal care at this time. Dr. Roberts is joining us via Skype. Welcome to the show, Doctor.
Thank you very much for having me.
Kudos to you and your colleagues for your efforts at this time.
Thank you. It's getting really tough, so thank you very much.
Okay, it's more than 3 months since government at all levels directed resources to stop the further spread of COVID-19. What is your assessment of ongoing efforts to flatten the curve?
The efforts are highly commendable. I must say again and again, and not because I'm biased, but you know that I am. Lagos State has done a tremendous job. The State Commander has been on board, he's getting the updates, he's following the science, and the efforts are really commendable. We must remember Lagos is a unique state. The population is actually totally out of character, out of proportion to the size of the state. And therefore, it is tremendously important that everybody gets on board behind the incident commander to obey the public health directives that we're putting out about physical distancing. And notice I use the word physical and not social. Physical distancing, keeping away from crowded areas, maintaining the hand hygiene, maintaining the use of sanitizers, and most importantly, maintaining the use of a face covering to cover the nose and mouth so that we can reduce the amount of virus in the environment and reduce the transmission.
Okay, to start with, how safe is it to get pregnant during COVID-19?
Now that's a very key question because you see, getting pregnant, one assumes that one has the capacity, financial and otherwise, to not only get pregnant, stay pregnant, deliver a healthy baby and be alive at the end of it and be able to bring up that child to attain his or her full potential. So the issue isn't just in the getting pregnant. The issue is everything that comes with it. And what we are finding in this COVID situation is that there's a cascade of events leading to what is called a shadow pandemic. And that's the issue that I'm hoping that we want to address at this point. Because for somebody who is happily married and together with a spouse, they have both decided to bring a new life into the world, getting pregnant is a natural consequence of their staying together. But if the girl or the woman is not in that position, then getting pregnant may not be the desired outcome of whatever she's facing at that point in time. And that is something that we're beginning to see a lot more of in this pandemic situation.
Wow. Is there any evidence that pregnant women are at higher risk of infection or complications from COVID-19?
Aha! So far, and I just checked this morning to make sure I'm up to date with the research because I knew you'd ask me that question. So far, there's no clear evidence, there's no clear data to say that COVID disproportionately causes more severe illness in pregnancy, at delivery, or for women who are breastfeeding babies. So far, may just be a process of time, but so far it looks as if pregnant women, women coming into delivery, women who are breastfeeding are at the same risk of catching COVID and are at the same risk of either remaining asymptomatic, developing mild to moderate symptoms, or becoming severe and getting to critical. The problem that we have here is what I call the indirect effects of the pandemic on girls and women. And this is mostly deriving from the reduced access to health service.
Okay.
So if a girl or woman is pregnant, if it's a girl, of course, number one, why is she pregnant? Could she be pregnant as a result of domestic violence or rape or sexual exploitation? Is it an unintended pregnancy because she's no longer in school, no longer, engaged in a profitable manner? So that's on the girl side. Supposing it's a woman, is she subject to the same unintended pregnancy? And then how do they get access to antenatal care while they're pregnant? How do they get access? Are they going to get access to delivery services, with hospitals turning women away because they don't have the right training or the right equipment to deal with it? So these are all questions we need to be asking. Lagos State is doing a tremendous amount of work in making sure that primary health care clinics remain accessible, but we still have a long way to go. I'm not saying that it's all Uhuru right now. We still have a long way to go. At least we are going in the right direction. But there is a problem with closed schools and young people left unsupervised, unengaged, and therefore a lot of unintended consequences such as rape and pregnancies. These are issues we are having to deal with.
Okay, thank you so much for clearing the misconceptions about this. That means coronavirus cannot affect pregnancy outcome. Okay, so that brings me to my next question. I still need to ask this question. During this time, which mode of delivery would you recommend or is safe? We know we have the cesarean section, we have the natural birth. Which mode of delivery is safer during this pandemic?
This is a trick question and I'm not going to fail. Every pregnant woman is an individual, and the mode of delivery has to be decided between her care provider, herself, her spouse or family, what they want, what is safe for her based on her health condition. So there's no one size fits all.
Okay.
You recall that, of course, in the recent times there have been accounts how Luth has had to step in and deliver women who had COVID and were either pregnant with twins or had difficulties, and we've done a fantastic job. But that is not to say that women haven't been delivering throughout this period. So my advice, I'm sure this is going out to all the listeners, is that every woman who is pregnant needs to be talking to her care provider and needs to come to a decision as to what method of delivery she wants or is best for her given her unique health condition. There is no one size fits all.
Okay, what advice do you have for mothers and healthcare providers now when you're talking about routine antenatal care, postpartum, or even post-abortion care?
You need to know who your midwife is. I think the midwives are uniquely positioned to be able to identify danger signs, to earn the trust of the women and girls they're talking to, and advise accordingly. Because many times these, as a woman, of course, I've been pregnant several times, it is the person you trust to give you good advice, sound medical advice that you're going to be talking to. And because we thank God for technology, we can talk to them. You can talk to them using your phone, you can video chat with them. So I would advise every pregnant woman to have her midwife on speed dial and be talking to them, asking them questions. I work with an NGO that has their midwives, and the midwives have developed WhatsApp groups with all the pregnant women in the group, even those who have gone to delivery, and they're sharing pictures and they're sharing information and sharing advice. And any woman who has a question or a query can put it to the group and know that she's going to get sound advice. And of course, the midwife is uniquely positioned and trained. She can spot a danger sign and alert when the lady needs to go to a hospital and see a doctor, and also alert the doctor and the hospital that this woman is coming and this has been the thing she's complaining about or she's having. So I advise every pregnant woman, get your midwife on speed dial, make sure she's on a WhatsApp chat with you, and talk to them as frequently as you need to.
Okay, Dr. Roberts, is it safe for an infected COVID-19 mother to breastfeed a baby? Can she perform skin-to-skin breastfeeding?
Again, it depends on her clinical condition. Most and generally, if she's asymptomatic, she is better off breastfeeding the child. Because one thing we do know, this COVID, this SARS-CoV-2, doesn't seem to have as serious an effect on the younger generation, younger ages, as it does on those older. And of course, bearing in mind that a woman who is breastfeeding is in the younger generation and rather than in the older. So she's likely to remain asymptomatic. As much as possible, if she's asymptomatic and she knows she has COVID, she should wear a face covering when she's breastfeeding the baby, because it's only the respiratory droplets that carry the virus. So otherwise, skin to skin is perfectly all right. The baby will gain more from the breast milk than the danger of not using breast milk for that child and risking the dangers of diarrheal disease and malnutrition.
Okay, let's look at the mental health of pregnant women suspected with COVID-19 alongside the stress of antenatal and postnatal care. How do you manage at this time?
That's why there's got to be a lot of communication, because the mental health, in fact, the mental health stress that a lot of people are facing at this time is not being emphasized enough. First of all, everybody is in a position of heightened anxiety. We're all that little bit more anxious. You know, there's a stigmatization that has been attached to COVID, which most and generally I personally don't understand, seeing as it's something that it's a disease that you are susceptible to so long as you breathe. Anybody who breathes is likely to be susceptible to this infection. But the mental health status of women, of pregnant women, means that they need to have a place where they can safely express their concerns, express their anxieties, and get effective counsel, wise counsel. And the midwives are uniquely positioned to do that. And that's why we have encouraged the midwives to set up these WhatsApp groups. They ask the funniest questions, quote and unquote, which are not funny because it allows us a position, a place where we can now address these concerns. And the important thing is that we're addressing the concerns even for women who were too shy or embarrassed to ask.
Okay.
And then they get the information, they say, thank you. Oh, this is so useful. I did not know. Oh, this is so helpful. I feel better already. So communication is key. And I'm very happy to be on this program with you, so that, because this is part of the communication we're talking about. Like I tell my students all the time, there is no silly question. The only silly question is the question you do not ask.
Okay. So
any question anybody has about this disease, what they need is a safe place or a safe person where they know that if they ask the question, they won't be laughed at, they won't be scorned, and they'll be given sound, wise counsel. So trained midwives are a unique position to handle this, and they are all over. Of course, Lagos State has a good bunch of them. I've worked with several, and they are just amazing.
Okay, I will need you to reassure pregnant women or women out there, or expectant mothers out there now, on the need to make use of the hospital to seek medical help early enough at this time.
Well, the paradox is that we don't want them to go to hospital unless they absolutely have to, because there's no point exposing them to infection. That's why I keep saying they need to be in communication with their care provider.
Okay.
And this is a time, text messages work, WhatsApp works, video chatting works, be in communication with your care provider. And it is your care provider who will be able to, your midwife, be able to advise you if you really do need to, because a lot of the issues that we have to face in during the antenatal period, most and generally can be handled remotely. Then they can be scheduled to go for their antenatal clinic session to get all the measurements, the urine testing, the blood pressure checks. They can be scheduled in such that there is not a whole crowd of women there at the same time, so that they can be scheduled to go and still have the physical distancing that keeps everybody safe. And that's why, but you see, in between times, they need to have that daily communication with somebody or someone they can trust.
We have been talking to Dr. Alero Roberts about the impacts of COVID-19 on maternal care and sexual and reproductive health in Nigeria. Dr. Roberts is a public health physician and a maternal and child care specialist. Soundhealth continues in a moment with trending health news. Okay, Dr. Robert, as a maternal and child care specialist, let's quickly look at some myths and misconceptions about COVID-19 and sexual and reproductive health rights. Is it true COVID-19 can be contracted sexually? Because earlier you said no questions are silly.
That's a perfectly valid question. So far, and I must emphasize this, the data has not shown that it can be contracted sexually. As different from now, let me be a bit graphic here as much as public family viewing will allow.
Okay.
Don't forget that when a man and a woman come together, they are close, their faces are within 1 meter of each other.
Yes.
If at all there's going to be transmission, it is still going to be by respiratory droplets than necessarily by other bodily fluids. So there will be, so a husband and wife, who stay together, obviously if the husband gets COVID, the wife will get it. If the wife gets COVID, the husband will get it, because they stay. That's why we insist that if one person becomes positive, they should self-isolate in a separate room. Now we know Lagos State is a very crowded state. Accommodation doesn't always permit people to be able to self-isolate in separate rooms, and we tend to treat families as what we call an epidemiological bubble. So we treat the family as one unit, when one person has the disease. So no, to answer the question, the data does not yet show that there's strictly sexual transmission the way Ebola or HIV/AIDS is not even Ebola, HIV/AIDS. Let me be specific.
Okay, who is more at higher risk of contracting COVID-19?
The sound has gone off.
Okay, can you hear me now?
Yes, I can hear you now.
Okay, who is more susceptible to contracting COVID-19? A man or woman? Who is at higher risk?
Very good question. That one, the data has shown there's a 2-to-1 ratio. Twice the number of women, twice the number of men are getting infected compared to women. So we've got 66% men, 33 to 34% women.
Okay.
We don't know why.
Okay. I was about to ask what could be the reason for this.
We don't know why yet. All watching the data. This is one time where the world has come together as a global laboratory. Wow. Everybody is learning from everybody.
Okay, so how accessible are sexual and reproductive health rights services at this time, if you're to rate it?
This is a big problem. This is a huge problem. And globally as well as locally, there's been a reduction in access to sexual and reproductive health services. And we're beginning to see the repercussions even locally in Lagos. But this is a global issue, and it's a cascade of events. Like I said, first of all, money has been diverted from sexual and reproductive health service programs to combat the pandemic naturally.
Okay.
So that has further reduced access. Secondly, schools are closed, leaving young people unsupervised, unengaged, and therefore subject to more vulnerable to sexual exploitation than ever before. Thirdly, if they were in school, they're having comprehensive sexuality education, called whatever it's called. That is not happening in the online learning that's going on. And then you have to then remember that there's even a gap in the online learning between those who can afford it and those who can't. So that further, jeopardizes the situation as we see it. And then even when a girl manages to overcome all these challenges, there's the issue of online bullying, which has led to a lot of problems, and we are seeing how it has caused an uptick in the rape and sexual violence that we're seeing even in Nigeria.
Okay.
The other issue is that because of this, there's now, we don't have a safe abortion law.
Okay.
Left to me, and it's a bit similar. I don't believe there's anything called a safe abortion, because no operation can be totally without risk.
Okay.
So what we want to do, what the sexual and reproductive health services are supposed to be able to do, is to prevent the number of unintended, unplanned pregnancies, and particularly prevent them in girls who are more vulnerable to the poor outcomes than older women.
Okay, so there's no doubt there is an interruption of services. Almost all resources are directed to beating the pandemic, while other services, especially sexual and reproductive health right care, are pushed behind. How can this narrative be changed?
Lagos State is doing a good job, like I will keep saying over and over again. We are now transiting to community-based care, where we're trying to bring the care up to the primary health care level. Once that is achieved, and once that is fully operational, of course, at the primary health care level, you have full access to sexual and reproductive health services. So anybody going to the primary health care could be going for antenatal, going for postnatal, going for immunization, could be going for management of common and endemic diseases, and also get access to sexual and reproductive services such as good advice, family planning advice, child care advice, and what to do, so that I'm hoping that becomes operational very quickly, and then we hopefully will begin to see a reduction in these unintended consequences that we're seeing of shadow and pandemic.
Okay, most essentials are sold out, including family planning products. Products like the condoms, emergency pills in cities, let alone IDPs. Is there a way this vacuum can be filled?
Well, that's a very difficult question to answer because it speaks more to the socio-economic downturn that we're seeing than to just the availability of family planning commodities. So it's very difficult. Don't forget that supply chains have been disrupted globally. Production lines have been disrupted globally. And these are the local effects that we are seeing down on the ground. Until we get back to international travel and trade, and it comes back fully. To be honest with you, if you have a limit, we are a country of limited resources. And if we are expending all our resources to make sure that our healthcare workers are safe and critically ill patients can be treated, it means we're spending more of our resources on PPEs, on ventilators, on making sure that everything needed to keep people alive, and therefore less resources are going to the that is something that has to change. But until we get a handle on this, it's not going to change. And that's why we're imploring everybody to take personal responsibility, because we must, it is in our hands. Number one, clean hands save lives. Wash your hands regularly. Number two, mask. Cover your face and mouth so that we can reduce the prevalence and the incidence of cases and get back to regularizing supply chains and regularizing health services, including sexual and reproductive health services.
Okay, the results and effects of all these are staring at us right in the face. And from your response, are we looking at a baby boom era at the end of it all?
I really can't say. The danger is that this a baby boom era will presuppose that pregnancies are happening in women who are able to safely get through the delivery process. What we fear is an uptick in maternal mortality, and that would be very, very sad. Maternal and infant mortality, because we're seeing these pregnancies in girls and women who are not able to safely bring to delivery and through the postnatal care, and they bring the child past his or her 5th birthday. So a baby boom sounds wonderful, but I fear that there will be more of an uptick in maternal and infant mortality.
Okay.
And morbidity that is associated, because that's another thing we don't talk about. The woman or the girl gets through the delivery and then ends up with horrendous consequences. That's something we're not talking about enough. It can happen. It will happen.
Okay, as we wrap up this segment, what are your final thoughts?
Oh, very, very simple. Please, physical distancing. If you don't need to go out into a crowded area, please do not. And if you must, wear a mask, cover your hands and face. And clean hands save lives. Wash your hands frequently and regularly using soap and water under a running tap. And if you can't wash your hands with soap and water, use an alcohol-based sanitizer. These very simple interventions are working. We have seen them work even in high-income countries. They are the only real weapon that we have against this virus, and we must employ it.
Okay. Thank you so much, Dr. Roberts. We sincerely appreciate your time and resources on Soundhealth.
Thank you for having me.
We have been talking to Dr. Alero Roberts about the impact of COVID-19 on sexual and reproductive health rights. Dr. Roberts is a public health physician. It's still Soundhealth on Lagos Television. This week, we take a look at Ellen Keller Deaf Blind Awareness Week. In this package, we highlight efforts to raise awareness about a number of conditions involving both vision and hearing problems. where we drop the anchor on today's episode. Please seek medical help early enough and join hands with healthcare workers to flatten the curve. Do not increase the statistics by adhering to all precautionary measures against COVID-19. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social. #Soundhealth. A sound health is a sound mind. Make healthy living your choice.